Dr. Ali Imran, editor Disease Digest magazine. So it's a pleasure to have you here with us. So can you self-introduce yourself before I pose questions?
Assalamu alaikum. My name is Dr. Abdul Jabbar. I was the founder of Pakistan Endocrine Society and the president and vice president in the past. I worked for 20 years in the Aga Khan University as professor of medicine and head of diabetes and endocrine section, and I started the first fellowship program in endocrine in Pakistan. Currently I am based in Dubai and I work in the Medcare hospital. There I am involved in the faculty in the Mohammed bin Rashid University of Health Sciences also.
So it's very honorable and pleasure to have a physician of the global perspective. So now as we have discussed Pakistan context, how you see that in Arab world, the endocrinological disorder and especially the diabetes affecting them, and what is your opinion about that?
So diabetes, as we know, is a global disease now. Everywhere in the world it's coming up more and more because there is more prosperity, more obesity and more modern way of life and fast food and everything available in Dubai, UAE and the Middle East. We see much more obesity and diabetes there. But at the same time, for most of the patients, there are opportunities for the clinical care and availability of the medical devices and medicine.
At par with the Europe and America.
Exactly. On the other hand, when we say in Pakistan, it is not so much there. So our obesity is not at par with them, but our diabetes is growing and quite at par with them. So our diabetes is different. It's not entirely due to because of obesity, but it's because of the metabolic changes in the body, in which in some of the people it may be linked to patients being not obese, mothers being obese or mothers being undernutrition during the pregnancy, and because of the non-availability of the good medical care in all the centers, they are usually not diagnosed or diagnosed very late, so they end up with a lot of complications.
So as now I understand, country to country and continent to continent, the diabetes factors might differ, as you mentioned, between Arab and the Asian population like Pakistan. So now, what would be your recommendation with such an experienced academician, researchers and clinicians that we should contain and control this diabetes in Pakistan as well as in Arab and the global context?
So as I always say in my talks, for everything we always say prevention and preventive strategies are most important.
Okay, true, agree.
And obesity, as we now declare, is the mother of all diseases.
Okay.
Previously we used to say diabetes is mother of all diseases.
And obesity is now declared as a disease in itself.
So obesity is now the mother of all diseases
as well.
So now if I see in my clinic a 5-year-old, a 10-year-old or a 15-year-old who comes to a general practitioner or family physician for something unrelated to diabetes and is found to be diabetic, or is found to be obese,
or overweight,
he
starts from being overweight.
His or her mother or father or family history of obesity or diabetes is there, we should start counseling them.
Yeah, and bringing them a healthy lifestyle, right kind of diet as a growing child, and as physical activity plus avoidance of tobacco. So, sir, in the last, how you see that we can say healthy living in overall health in prevention and lessening of the non-communicable disease, which include diabetes, hypertension, blood pressure and many others. How do you see and what is your message?
So in general, as we see, there are 2 or 3 aspects to that. One is your family.
Yeah.
If it is in your family, in your genes, it's difficult to avoid it altogether. You can postpone it. Mm-hmm. So the most important thing doctors have to learn that they keep blaming the person or the patient. Somebody comes to me, you are overweight because you are not eating healthy. Yeah. And the other side of the person can say, doctor, I exercise 3 hours every day.
Yeah, it's like a genetic predisposition or at time eating disorder issue, even the mind get messed up,
So that's number one thing. So ask about what is the background, then give them the advice. And the next important thing is for everything like chronic disease model is the follow-up. If I tell you stop eating this and this and this because you are going to be obese or overweight. You stop it for a month, then you forget it. So if the follow-up is not happening, and there your role, especially or the role of media, is crucial and important. You can advertise for a shampoo 1 time per day, 3 times per day, or 10 times per day. Why do people spend so much to advertise 10 times per day? Because people will remember.
Okay, that's right.
So the messages are if coming like that, if those messages coming once a week, once a month, once every 2 months, people will remember.
I mean, social media and technology should be used in education and awareness. And sir, lastly, I mean, because of your short term time, and sir, we like that. Have you ever got a chance to see Disease Digest? And if you have any impression of that?
I always see it, and your team has been contributing towards it, and I've been a contributor to that.
And we very
I
much-
think it's very important, but I think we have to achieve
And we have
somehow.
recently put up in the YouTube as well, so that
Exactly.
people should be listener, and we will be translating in Urdu. So we thank you for your interview, and sir, we wish that we will
Yeah, it
collectively
will spread wide so that people. It is another important channel for
Media and
increasing
digital.
awareness for everything.
Thank you very much, sir, for your
Thank you,
time.
sir.
Thank you, sir.